Did you know that 1 in 8 people living with HIV in the US don't even know they have it? That's over 150,000 people walking around unaware. But here's the thing, HIV isn't a death sentence anymore. With early detection and treatment, people can live long, healthy lives. So, why aren't more people getting tested? Fear, stigma, lack of access. This December, for AIDS Awareness Month, let's change that. Get tested, know your status, and spread the word. It's time we end the stigma and start saving lives. Because knowledge is power, and in this case, it could be the power to save your life or someone else's. Don't wait. Get tested. Be aware. Be alive.
Flu vaccine effectiveness for 2023-2024. Season Hello Marvin AME. Zion Church. Each year, the flu vaccine is designed to protect against the flu strains that scientists believe will be most common. However, the effectiveness of the flu vaccine depends on which flu strains are most prevalent and how they compare to the strains that the vaccine protects against. Because of this, flu vaccine effectiveness varies from year to year. Scientists don't yet have final estimates for the effectiveness of the flu vaccine for the 2023-2024 season, but preliminary data show a range of 33%-49% effectiveness in adults. Centers for Disease Control and Prevention. Interim estimates of 2023-24 seasonal influenza vaccine effectiveness, United States. Flu tests, who should test and when? During past flu seasons, the CDC tracks seasonal flu vaccine effectiveness each year. Over the past 17 years, the highest effectiveness was in the 2010-2011 season, when it was 60% effective. During the 2020-2021 flu season, the CDC didn't estimate the effectiveness of the vaccine because transmission of the flu was historically low, likely due to COVID-19 precautions that also protect against the flu. What to avoid after flu shot and do instead. Reasons to consider getting a flu vaccine. The flu vaccine, flu shot or nasal spray vaccine, significantly reduces the risk of contracting the flu. Consider the 2019-2020 season. People who had the vaccine were 39% less likely to get the flu than those who did not. In addition to preventing illness, the flu vaccine also reduces the risk of hospitalization and death. Here's what researchers have found about the flu vaccine. 1. Getting the vaccine reduces the risk of intensive care unit, ICU hospitalization by 26%, and the risk of death by 31%, according to a 2021 study. 2. Among adults who are hospitalized for the flu, people who are vaccinated are 59% less likely to need intensive care unit, ICU care, according to a 2018 study. 3. People with heart disease who get the vaccine are less likely to experience cardiac events. 4. People with diabetes and chronic lung disease who get the vaccine are less likely to be hospitalized for those conditions. 5. Pregnant people who get the vaccine are 40% less likely to be hospitalized for flu than pregnant people who did not get the vaccine. In addition to protecting you, getting the flu vaccine can keep you from contracting the flu and passing it to others, including infants and the elderly, who are at higher risks for complications. Pregnant people who get the vaccine help protect their baby from the flu, passing on the protective antibodies developed by the vaccine, which can be valuable during the first 6 months of life when a child is not able to be vaccinated. Can a rash be a symptom of the flu? What does it mean to be immunocompromised? Types of flu shots and vaccines. All flu vaccines protect against the same strains of flu. In 2024, the FDA reduced the number of strains included in the vaccine from 4 to 3, because one of the previously included strains hasn't been detected since 2020. Because the vaccines protect against 3, they are called trivalent vaccines. The CDC doesn't recommend one type of vaccine over the others. However, some people, including people under the age of 2, over the age of 65, who have allergies, or are pregnant, have special considerations and should talk to their doctor about which vaccine is best. Adults 65 and up. Some studies indicate that a higher dose vaccine or an adjuvanted flu vaccine, one with an additional substance called an adjuvant that enhances the body's immune response to an antigen, creates a stronger immune response, produce a stronger immune response, and are therefore more effective for this population. The CDC recommends people age 65 and older receive a higher dose vaccine or an adjuvanted flu vaccine, one with an additional substance called an adjuvant that enhances the body's immune response to an antigen. 3 vaccines are specifically recommended for this population. 1. Fluzone High Dose. 2. Fluad. 3. Fliblock Senior Flu Shots if you're allergic. According to the CDC, people who have severe allergies to an ingredient in the flu vaccine or who have had a severe reaction to the flu vaccine should not get a flu shot. Most flu vaccines are made using eggs or egg protein, but the CDC states that people with egg allergies can get any flu vaccine, regardless of the severity of their allergy. The CDC previously had recommended that people with egg allergies should get their flu shots in an inpatient or outpatient setting. For those interested in an egg-free flu shot, the 2 egg-free vaccine options are 1. Flublock, approved for people ages 18 and older. 2. Flukelvax, approved for people ages 6 months and older. If you're pregnant people can get any flu vaccine except for flu mist, which contains a live virus. Study shows flu shot in pregnancy does not lead to health issues for children. Nasal spray option flu. Mist is a vaccine administered via a nasal spray. It is approved for people ages 2 through 49. However, it's the only vaccine that contains a live, weakened virus, and it should not be used by pregnant or immunocompromised people. Talk to your healthcare provider about whether flu mist is safe for you. What is the flu mist flu vaccine? Flu vaccine for babies. There are 5 flu vaccines approved for babies 6 months and older. They are 1. Afluria. 2. Fluarix. 3. Flukelvax flu vaccine effectiveness over time. The flu vaccine needs 2 weeks to become fully effective, and protection is thought to last for at least 6 months. But a person's antibody levels in response to the vaccine can decrease over time, and different flu strains may be circulating. Because of that, and because each year the vaccine is tailored to the most concerning flu variants, people should get a flu vaccine annually. Flu vaccine side effects. Side effects of the flu vaccine are usually mild and go away without treatment in a few days. Common side effects include 1. Soreness, redness, and swelling where the shot was given. 2. Headache. 3. Fever. 4. Nausea. 5. Muscle aches. 6. Fatigue rarely. Allergic reactions occur, often within minutes of the vaccine being administered. If you experience swelling, racing heart, or trouble breathing, seek medical attention immediately. Extremely rarely, no more than 1 or 2 cases per million people who receive the flu vaccine, a person may develop Guillain-Barré syndrome, an autoimmune disease. 3 flu shot side effects. Summary: the flu vaccine can prevent illness, hospitalization, and death. The CDC recommends that everybody aged 6 months and older get the vaccine every year, with very rare exceptions. The effectiveness of the vaccine varies since the vaccine only protects against certain strains of flu. Over the past 5 years, the effectiveness of the flu vaccine has ranged from 29% to 40%.